How much was your weight before surgery?
Sir, 134.
134. And it has been like 6 months?
Yes, 6 months, sir.
Okay. And do you know the name of the surgery?
Yes.
What was
I
it?
know, sir.
What is the name?
It's a gastric bypass.
Gastric
bypass.
Yeah.
Bariatric surgery.
Yeah. It's not partial, it is mini.
Okay.
Mini gastric bypass.
Okay.
Never forget this name.
Right.
Because now, this procedure has given you a new...
Yes, I'm
yourself.
extremely happy. My levels were great. Everything is so very good.
So you came down from 134
To
to 96
Yeah.
in 6 months.
Yeah,
And
6
still you are going down.
Still going down.
Yeah. And what about the energy levels? You feel
Energy
it's
levels
good?
are fine.
No
They're good.
weakness,
They're
nothing.
good, no weakness.
Okay. But still, as we discussed earlier, that whatever you are taking,
Right.
you need to keep a watch on your proteins actually.
Yes.
You need more of proteins
Right.
to be healthy. We
Right.
want our patients to be thin but healthy.
Right.
So for proteins, you can take more of milk. If you cannot take raw milk, you can try different kind of things like cold coffee
Right.
or other shakes or whatever you. Milk should go inside your body in some form.
Right.
We have done about 180 centimeters of bypass in your case,
Right, sir.
which is about 6 feet,
Right.
and it's a moderate dose of mini gastric bypass.
Right.
And you see the strength of
Yes.
mini gastric bypass. So now the good thing is that your cholesterol levels are good, you lost good amount of weight,
Yes.
and your heart is safer, your brain is safer, chances of having stroke have gone down by 100%. But all those things are on one side,
Right,
but
sir.
we don't want to see you weak.
Yes, sir.
So for that, you should go to gym, do some exercise.
Right, sir.
So your muscles should, build up slightly,
Right, sir.
and take more of proteins.
Right.
And we were discussing about your dumping syndrome.
Yes, sir.
So could you explain what happens when you take some sweet thing or some ice cream?
Like I used to be very, very fond of sweets earlier. Now,
Okay.
whenever I take, my favorite sweets is like ice cream, gulab jamun or something.
Okay.
The moment I take, say, half a piece also of gulab jamun,
Uh-huh.
the feeling inside is very uncomfortable.
Uh-huh. Okay.
If I take the full gulab jamun, then I remain uncomfortable for an hour or two.
For 1 hour or two.
That which absolutely tells me next time I should not
I
try
should
it
not
out.
take this. This is what we label as dumping syndrome.
Right.
Basically, mini gastric bypass works on the basis of dumping syndrome.
Right.
There have been different kind of surgeries like sleeve or band where we have total restriction.
Yes, sir.
What we have seen is over restriction patient doesn't like.
Yes.
Patient wants some luxury.
Yes.
And with MGB, gradually you start taking a moderate amount of food.
Yes, sir.
But then with sleeve or band, once you start taking moderate amount of food, then you start gaining weight.
Yes, sir.
But here, what is the difference? It will teach you to have healthy things.
Healthy
Like
things.
ice cream, not good.
Yes.
And fried things, not
No,
good.
same thing happens.
Yeah.
Even fried things.
Mhm.
Sometimes out of sheer habit that you were fond of it earlier,
Yeah.
you take that
Mhm.
and then feeling thereafter.
Yeah.
And in case of fried, it lingers on for hours together.
Yes, because
In
what
case
happens?
of sugar, though, it is alright after an hour or so. In case of fried, it lingers on
Yeah.
for 4-5
With
hours.
fried, say your whole day is gone.
Yes.
Yeah. So.
So next time you
yeah.
don't touch. Say, "Man, come on."
Yeah, I don't
It's
want
like
this.
that. I know.
Because with fried, what happens? The bypass does not absorb the fat. You see, a lot of oil might be passing through
Yes.
your fat,
Yes.
your bowel.
It does.
Yeah, so that means whatever oil or fat you're eating,
Yes.
most of it is getting out of your body.
Yes.
So if you eat fried food,
Yes.
it has to get out.
Yes, sir.
So it gets out in the form of gas, which is foul smelling,
Yes.
and oil,
Yes.
which doesn't give you a comfortable
It does
feeling
not.
after
It's,
eating.
it's a very, very
So
uncomfortable.
that is the reason that you don't feel good and you don't try to eat it again.
Very
So
good.
that's how we say that MGB would teach you to have a Mediterranean diet
Yes.
automatically.
Right.
You don't need any diet charts or anything.
No, we don't need
But
that.
the only worry is you should take a good amount of protein and do some exercise every day so that your muscle doesn't get loose and you look good.
Another
Yeah.
thing I want to tell the other patients also, I've lost 38 kgs.
Uh-huh.
There is no skin sagging.
No skin sagging.
Absolutely
Not
no.
at all.
Uh-huh. Uh-huh.
Zero it is. You know what I have followed
Uh-huh.
is a very fine thing.
Uh-huh.
You have that morning walker kind of thing, which
Uh-huh.
is available on the net also.
Okay.
If you do sincerely every morning for 30 minutes,
Mm-hmm.
I think it will avoid skin sagging in many cases.
See, this is like.
It is,
Uh-huh.
it's nothing, it's shaking up your tummy by mechanical means, it's motorized.
Yeah. So it shakes up.
Your legs are here,
Okay.
it's shaking like this.
Oh.
So the entire portion shakes
Okay.
for those 30 minutes.
Okay. Okay.
So this was my belief, maybe this may work, but it has worked.
But it has worked in
So
your case.
in case of some other people
Yeah, it's
can
good.
benefit out
We
of
can
it.
advise because it has got. There's nothing
And
bad
it's
in
a
it.
passive
You can try it.
exercise.
Yeah.
It's a very
passive
bad
exercise.
advice.
It's good.
Videos are available on
Yeah.
YouTube.
Yeah. That can be tried, but we don't promise this to anybody.
No, we
because
cannot
this-
promise
it
it,
might
but
work or might
it
not
may
work.
work in
Yeah.
some cases.
Because what we see is in about 60 to 70% of our patients, there is some skin sagging. And what I see is it depends upon the pre-operative stage. If your tummy was already hanging up to the level of your knees,
Yes.
it's not supposed to come back.
Yes.
You see, your tummy was huge, but it was not
No,
hanging.
it was not hanging. It was
Yeah,
not.
so that's another
That time
factor.
also it was
And that depends on the elasticity of the skin.
Right.
And maybe this factor might work.
Okay.
Yeah. So we will.
And another
see.
thing, look, totally sir, in terms of you after this mini gastric bypass, saying sir,
Mhm.
you have that gas problem also.
Mhm.
If you do this exercise in the morning, since it shakes up the entire system inside,
Okay.
it
Okay.
eases you.
So yeah, that's good. So if you want less of gas, take less of oils.
Yes.
So take vegetables, fruits, salads, boiled vegetables, grilled vegetables.
So
You
I
have
think
no gas at all.
After MGB, you write a board oils are forbidden because you cannot take the oil. You
Yeah.
don't feel like taking oil.
Okay.
Anything fried.
Yeah,
I was very fond of puri chana, things like that.
yeah.
Wow, God, I can't.
Okay.
I can't.
But see, this effect tapers with time. What we see after 2 years, 3 years, body starts adapting to it.
Right.
And maybe the 40% thing will be back, and then you might be able to take some puri, chana, but not much.
Biggest
in a moderate
disadvantage
quantity,
is
yeah.
that the very sense of taste has gone. It's gone for a second.
Yeah, taste, there is a lot of research going on after gastric bypass.
Yes.
Almost 70% of the patients say that their taste has changed.
Yes.
But they don't say that it's like totally bland. The taste changes, something which was looking
Listen,
good earlier.
I'll tell you.
Yeah.
I'll tell you. Another very important thing which I noticed is
Mhm.
whatever is salty,
Okay,
it tastes to me the same what was tasting earlier.
earlier, okay,
Whatever is sweet,
okay.
it is not tasting the same. It is not tasting the same.
Yeah, this could be again, we can explain it from the dumping point of view,
Right.
because if you take some sweet thing and it doesn't suit you, ultimately there are a lot of psychological things also, have working underneath. So the taste changes.
Yes.
Even the liver is shedding a lot of fat.
Right.
Earlier you had a fatty liver,
Yes.
and now your liver is normal. So these things matter because liver is, you can say, it is breaking down.
Right, sir.
So that is why the taste changes. And with time, everything comes back.
It will come.
Yeah.
That's all.
Right? Nice.
Thank you
talking
so
to
much, sir. Thank you so much.